It affects 1.3 billion people worldwide. In the United States alone, nearly 120 million adults, almost half of the adult population, lives with it. Yet, only 1 in 4 people have it under control. It contributes to more than 670,000 deaths every year in the United States alone, and is one of the strongest predictors of strokes, heart attacks, heart failure, and kidney disease. Over $130 billion are spent every year managing complications associated with it. And yet, for something as common, as serious, and as expensive this is, most people can't even explain what it is. Even people who carry the diagnosis or people who take medication for it every single day. But today that ends, because today we're talking about hypertension, the so-called silent killer, what it is, why it matters, and what you can do about it. Welcome to Fuller Living, your space for empowerment, inspiration, and practical health nuggets. Here you'll find relatable guidance that fits your everyday life as you journey to a fuller and healthier you. I'm your host, Dr. Ashitey. Let's dig in. Welcome to Fuller Living with Dr. Ashitey. Wherever you are, whether you're driving to work, folding laundry, on a walk, or just taking a quiet moment with yourself, as always, I am so glad to have you here. Over the next 4 weeks, we're going to be doing something a little different. I'm creating a series. We're going to be talking about cardiometabolic disease. We're going to slow down and break down some of the conditions that affect us the most, the ones we hear about all the time, but rarely fully understand them. We're talking about hypertension. We're talking about diabetes, high cholesterol, heart disease. These are not rare conditions. They're so common. They affect our parents. They affect our siblings, our loved ones, our friends, so many of us. And yet, despite how common they are, so few people have ever been taught what it actually is or what we can actually do about it. So few people really understand it. So my goal over the next few weeks is to make things simple, to bring some clarity. I want you to understand what's happening inside your body, and that will empower you, because when you understand something, you're no longer afraid of it. You're no longer hiding. You know what to do. You're able to better engage with it. You're able to advocate for yourself. You're able to take control, pun intended. Got it? Control your blood pressure. You're able to take control of your health. I've cared for thousands and thousands of patients over the decades, and not decades, over the past decade plus. And most days, I'd say at least 25% of my patients have hypertension or at least an elevated blood pressure reading. Many of them either do not know that they have it, and even those who do don't quite understand what it is and why it matters. And what I've noticed over the years is this: when patients truly understand their condition, everything changes. They ask better questions. They make more informed decisions. They don't feel overwhelmed, and they become active participants in the care that I'm giving them instead of passive recipients. And that matters. Understanding how the body is working is very powerful. It gives you agency, it gives you perspective, and it helps you connect the dots between daily habits and your long-term health. So today, we're starting with hypertension. So let's talk about what it actually is. Before we go any further, let's simplify the language. When you hear me say hypertension, I simply mean high blood pressure. In medicine, we use the words interchangeably, but for today, and honestly for the rest of the series, I'm going to say high blood pressure. Same thing, no difference. So what is high blood pressure? At its core, it is mechanical. Your heart is a pump, and every time it beats, it's pushing blood into your arteries. And these are the vessels that carry your blood to the rest of your body. As the blood moves through your arteries, it's pushing against the walls of those vessels. And that force, that pressure, is your blood pressure. Think about turning on a garden hose, for instance. If the water is flowing gently, the hose is going to stay relaxed. On the other hand, if the pressure increases, the hose is going to stiffen. It's going to feel tighter, more strained. Blood pressure essentially works the same. Now, when we measure your blood pressure, we give you two numbers. The top number is your systolic number. It's the pressure when your heart is squeezing. The bottom number is your diastolic number, and that's the pressure when your heart relaxes between beats. Both of these numbers matter. High blood pressure means the force pushing against your artery wall is consistently higher than it should be. Key term here, consistently. Sometimes, under really stressful conditions, a person might have a single blood pressure that's high. Think about when you go to the dentist or the doctor's office. But usually, once the stressor is removed, the blood pressure gets better. That's not what we're talking about today. Today, we're talking about the medical condition when your blood pressure is consistently high. Okay? So, what's considered normal? A normal blood pressure is less than 120 over 80. That's right, less than 120 over 80. Now, a lot of you tell me 120s over 80s when I ask, but 120 over 80 is not necessarily normal. By the time your blood pressure gets to 120 to 129, even if the bottom number is still under 80, that's elevated. It's not hypertension yet, but it's also not an optimal range. Once your blood pressure hits 130 over 80, that's stage 1 hypertension, and 140 over 90 is stage 2 hypertension. But here's the thing. Blood pressure is not a light switch. It's a continuum. And your risk doesn't suddenly begin at 140 over 90. Your risk gradually increases as your number goes up. So by the time we label something stage 2 hypertension, the process has usually been going on for years. So if high blood pressure is simply increased force pushing against the walls of your arteries, what happens when it stays elevated for years? See, your arteries are not rigid pipes. They're living tissue, lined with a delicate inner layer of cells we call the endothelium. This lining is meant to be smooth, it's meant to be flexible and responsive, and it helps your vessels dilate and constrict appropriately, and it protects against clotting and regulates blood flow. But when your blood pressure is consistently high, that lining starts to experience stress. Let's let that sink in again and think about the garden hose. If the pressure inside the hose is high for a long time, the walls are going to start to stiffen. They're going to lose their flexibility and eventually they're going to wear down. This is the same thing that's happening in your arteries. And over time, that consistent pressure causes injury to the lining. And when it's injured, the body responds with inflammation, and inflammation attracts cholesterol particles. It promotes plaque formation, and that further contributes to stiffening of the wall. This is how blood pressure increases your risk of stroke, by the way. This is how it contributes to heart attacks in the same way it strains your kidneys. It's a gradual process. It's not loud, it's silent. It is a slow wear and tear quietly taking its toll inside your body. That's why high blood pressure is often called the silent killer. Most people feel completely fine while it's unfolding. There's no pain, there are no signs, no flashing lights, until one day something happens. And I don't say that to scare you. I say it because understanding this process changes the way we think about prevention. Too often, I've had so many patients say to me, I feel fine. I know my blood pressure is high when I feel this way, so they assume they should not be concerned. If you're waiting to feel your blood pressure before you act, I hate to tell you this, you're waiting too long. I've also heard this commonly from people over the years. That's normal for me. I want to be clear, your body disagrees. There's something else high blood pressure does that we don't talk about enough. It doesn't just affect your blood vessels, it affects the heart itself. Remember, your heart is a pump. If the pressure in your system is high, that means your heart is having to work harder and harder to push against that resistance. Now, imagine trying to push a door open when someone's pushing back from the other side. That's what your heart is doing when your blood pressure remains high for a long time. Over time, the heart muscle is going to thicken in response to that extra workload. And at first, that thickening is its way of adapting, but eventually, a thicker heart muscle becomes stiffer. It doesn't relax so well, and it doesn't fill up as well. And sometimes it doesn't even pump effectively. That's how high blood pressure can lead to heart failure. Now, heart failure doesn't mean that your heart is stopped. It means that your heart can't pump or relax efficiently to meet what your body needs. Eventually, people develop shortness of breath, swelling in the legs, all of this from fluid backing up, fatigue. And I'd like to emphasize again that this doesn't happen overnight. It happens after years of the heart pushing against pressure that was a little too high for a little too long. Now, if this feels heavy, I want you to take a deep breath because I've got some great news. High blood pressure is one of the most modifiable risk factors that we have. It can be controlled. When we lower our blood pressure, we reduce the risk of strokes, heart attacks, heart failure. We even reduce the risk of kidney disease. This is not a hopeless diagnosis at all. It's an opportunity. Here are 3 simple actions you can take immediately to help control your blood pressure. First, know your numbers. Don't make an assumption. Don't guess. Don't wait until something feels wrong. Awareness is power. Now is the time to consider getting a blood pressure monitoring device. I encourage people to have one if they can. I believe everyone should own one because checking your blood pressure periodically can give you some good information. At a bare minimum, however, you should schedule an annual appointment with your doctor to get your blood pressure checked as well as everything else. Even your dentist appointments, take note of the numbers and follow up with your doctor if they're high. Knowing your numbers and taking action really matters. Second, don't ignore your readings. If you're consistently in the 120s over 80s, I don't want you to panic, but it's something that you really do need to pay attention to. Remember, blood pressure is a continuum. Prevention starts or must start before the diagnosis. Third, protect your blood vessel and heart every day. And here are some ways that you can do that. Move daily. Aerobic activity, the kind that increases your heart rate, is going to help. And it's recommended that you get about 150 minutes per week. Sleep. Aim between 7 to 9 hours of restorative sleep consistently. Manage your stress, limit alcohol. Be mindful of the salt that you take in. You know, it's recommended that we don't have more than a teaspoon of salt per day. Work with your doctor if medications are needed. Listen, medication is not a failure. And sometimes, if style modification is not doing it all, you may need some medication, which can be life saving. Remember, the true enemy here is the blood pressure, not medication if you need it. This is about protecting your future self. I hope you now understand high blood pressure. You understand that blood pressure is really about a pump and pipe system. Your heart is the pump, your arteries are the pipes, and the pressure within the arteries have a direct effect on your heart, your kidneys, your brain, and other organs. But the good news is that there's something that you can do about it. You know what the numbers are. You know now that a number of 120 over 80 is actually a little elevated and that less than 120 over 80 is our goal. But now that you're armed with information, you're not going to panic. You're going to take action and you know exactly what to do. Now for our SMART goal for the week. Remember, a SMART goal is one that is specific, measurable, achievable, relevant, and time-bound. This week, the goal is simple. Check your blood pressure twice. I know I'm raising the bar. When you do it, make sure that you're seated and calm, and then don't forget to write it down. We're not going to panic because we're just gathering information because awareness is our first step in prevention. Specific, measure your blood pressure. Measurable, just twice this week. Achievable, if you don't have a blood pressure device, consider checking it at the drugstore. Relevant, This is part of your goal for living a healthier and fuller life, and time-bound just for a week. Today, we talked about something that affects a large population worldwide. High blood pressure is not just a number. It's a force against living tissues. It's causing strain on our vessels, on our heart. And over time, this can lead to strokes and heart attacks, kidney disease, and even heart failure. But it is also one of the most modifiable risk factors that we have. That means that when you understand it, when you know what's happening in your body, you can do things differently to improve it. We think differently, we're able to advocate for ourselves, and that is what this series is all about. If this episode shifted your understanding even a little bit, I'd love to hear from you. What is the one thing that you didn't know before today? Send me a message, share it on your stories, tag me on Instagram at Fuller Living Coaching, or share it with someone that you love because sharing is caring. Make sure that you're following this podcast. Like, share, subscribe. As always, it's going to help me reach more people and help more people live intentional and take healthier steps towards living a healthier and fuller life. And I'd love to see you next week because we're digging into type 2 diabetes and you don't want to miss it. Until next time, let's get to fuller living. Well, fam, that wraps up another episode of Fuller Living, where we talk about health in a bite-sized, relatable, practical, and fun way. Remember, it's not about being perfect. It's about making progress one small step at a time while remaining consistent. If you found this episode helpful, please subscribe, share it with a friend who might need a little bit of inspiration, and leave me your 5-star review. And if you're in Dallas and looking for a new PCP, look me up at southwestfamilymed.com. I can't wait to meet you. Until next time, let's get to fuller living.